Hey guys, so just a couple quick words on PPIs and acid reflux. So I'm not going to go into all the mechanisms of acid reflux, bacteria and intra-abdominal pressure and all these things, or really anything on that side. However, I've gotten this scenario a couple times this week, people wanting to stop proton pump inhibitors and then trying to re-acidify the stomach, if you will, or replace acid with betaine. So it's pretty well known that adding betaine HCL to bring these acid levels back up when they're low. However, one thing to keep in mind is with a PPI, so we use a common one like Prilosec, for example, half-life is extremely short. So the actual elimination of the drug is very, very fast. Now, the anti acid or secretory properties of it are going to last a little while. Depends on how much you're taking, how long you've taken it, how long it takes for those half-lives to eliminate all of it. But maybe three to 5 days or what have you. So in theory, normal acid secretion or whatever the person's able to produce normally is going to return back to baseline in maybe 3 days, right? So if you are taking these things out and then trying to replace with acid, some people definitely require higher doses to, again, replace, I guess, if you want to use that word. However, not everyone will. So it depends on, of course, what their acid requirements are of their diet, kind of what their ability to produce acid from those parietal cells, which are located in the stomach. So keep in mind that sometimes when people come off of these things, they don't require much betaine, or they don't require it for very long, or they don't require it at all. So, it depends on their ability to produce acid once it is removed. It depends on what other things you've done to kind of repair that GI and allow those parietal cells to work. Sometimes if you've done a lot of back end work already and then that PPI comes out, they might not need as much. Whereas other people that have higher acid requirements or poor function of parietal cells are not able to produce as much, and they may need higher doses of betaine. So essentially the PPI is just inhibiting that. It's binding and then it's inhibiting that pump on the parietal cell from essentially producing acid as it should. So keep in mind that you may not need a ton, or you might. So it just depends. Sometimes, or a lot of the time, doing a lot of that back end work on the GI is a good good approach. That way, when that is pulled out, if you're not planning on pulling it out right away, there's the ability to produce that acid is increased, and they may not need as much of that betaine or whatever it might be to get back to normal baseline. So keep that in mind, because I had a few cases where they add a bunch back in and they're like, oh no, I noticed it helped at first, then it got worse. Well, we maybe actually have too much acid again on the back end of it. So just keep that in mind when you're someone's removing that drug and then trying to get their acid secretion back up to normal.